It's a very real thing that there's a separation between a male clinician or a female clinician. In other professions, maybe it's not as much of a big deal if it's a man or a woman that you see, right? But in the realm of chiropractic, and I'm going to assume probably osteos face this, myotherapists face this, physios face this, dentists probably face it, but in the health space, you know, gender comes into the conversation because you're entering another person's personal space. That's one massive part of it. Another massive part of it is from a health perspective, men and women have very different health experiences. Men don't go through a hormonal cycle every 4 weeks, every 28 days like women do. Men don't grow children in their tummies and push them out. Men don't go through menopause. Men, you know, like they have their, of course, their own hormonal clocks, but when you think of the nature of the conversation, like why is it even a topic, women in chiropractic? Like why can't we be chiropractors independent of that? It's because there's really clear, obvious anatomical differences, health differences, cycle differences that we face. It's really easy for that to be weaponized in some ways, or it be our downfall.
Female chiropractors, and there's a bit of stereotype that comes along with that. Talk to us about your experience.
I think one of the biggest things is that people will look at you as a woman and be like, oh, she's not strong enough. Or oh, what's she going to do to be able to adjust me? It's actually really not about your size or your strength. It's about your precision and your speed. And anyone can be fast. It's not about, let me just, you know, put 50 kilos of weight on you and use gravity and hopefully boom, something will move. It's actually, there's a lot more to the art of chiropractic. But it was definitely a stereotype I faced in the beginning. I don't know if you faced anything similar.
Our height isn't also to our advantage, which
5'2" girlies.
Which makes it a struggle. It's like their first impression of us was like, you're not going to be able to adjust me. Yeah, it was hard initially to overcome that. Our techniques do have to vary for each person.
Yeah.
It's no different to, you know, male chiropractors adjusting a very small patient or a very small female. They also have to modify their technique as well. Even though they're technically stronger, they might be too strong.
And I think too, as women, we bring a different energy to the table than a man. You know, there's a different level of presence, there's a different level of love. The, you know, feminine touch to a masculine touch, I think, in my opinion, at least, is two drastically different experiences for a client.
Presence, I think that's something that we have to our advantage, because when you start seeing patients, and I guess you've created such a calm, compassionate environment, people tell you things and they open up about things that's going on in their life that they probably don't tell anyone else. And I think that that's such a privilege as female practitioners to be able to hear someone's story that they probably don't trust anyone else with.
Yeah, privilege is definitely the word for it. Before you said it, that was what came to the forefront of my mind, because yeah, you can just have these really heartfelt conversations. And I understand that, you know, in the ideal world, the table talk, we want to try to keep it as aligned as we can to chiropractic. But at the end of the day, these are humans that we're loving on and caring about. So if they're bringing to me other issues that will affect their stress or their hormones or their reproductive systems or digestive, like whatever it might be, yeah, it's a privilege that they feel safe to come to us with that. But it's also an opportunity for us to maybe give an approach that is more heart-centered than head-centered. Not that men don't have that capacity. You know, I've had, most of my mentors have been men and they are amazing in that way, but there's just something about, yeah, the female essence that we bring something different to the table.
You know, I'm not a psychologist, so I didn't expect, and this is what uni, again, doesn't teach you, is you don't know that people are going to come to you, and I guess the woke term for it now is trauma dumping. But that's kind of got a negative connotation, and it's not negative at all. But for people to feel safe enough, calm enough to open up to you about whatever's going on, again, it's such a privilege. But I definitely initially struggled with, I guess I'd call it compassion fatigue, because you care so much about these people, and it's hard not to take that energy home and think about it and think about, are they okay? Should I call them tomorrow and check in on them?
Yeah.
As much as you really want to. Like gives me goosebumps even just thinking about it, because I do have patients that I think about even now, talking about it, that they've opened up to me about things that they've not told anyone. They've never been able to even express it to anyone else. And it is such a privilege to be able to hear it, and even though maybe not have the best responses or advice for it, because we're not trained in that area, but just having someone to listen to you, I think, is very powerful.
What you just said is huge. Shout out to my first ever mentor, Dr. Adrian Cousin. I love you wherever you are. One of the things he taught me was the difference between the empathy and the sympathy, right? Because it's really, really important we carry the empathy for our clients. but it's even more important that we don't put ourselves in their experience and, like you said, take it home with us, right? And I think it's definitely a skill set that unless it's brought to your attention, you'll accidentally absorb it. And of course I care for my clients too, but when I first started in practice, you would go home and you would worry about them, and it would, sit heavy in your body, and then you quickly kind of realize, well, I can't love and serve my community if I'm taking on all their problems, right? Which is where that boundary of, I can be empathetic towards what's happened, and I'm so grateful you feel safe to share it with me. And sometimes it's about advice, sometimes it's just about being an ear, and sometimes it's just about checking and clearing their nervous system, right? But really I have to make sure that I can kind of put this, white light protective shield around me to I've got the love to offer you. I don't need to take it on board myself, but I can give you some guidance or some support where you need it. And I think, without that awareness, it's really easy to, take that stuff home. The other part of that is, I think within the chiropractic space, there's just a lot of assumption that female practitioners will work in the ped space or, deal with pregnancies. And that isn't always for everyone. My initial first 4 years in practice, I was in the middle of a city and I didn't see any children. Well, that's not true. I saw some children, but it definitely wasn't a family-based practice. Now being more in the suburbs, it's a whole different ballgame. It's a whole different energy in practice, which is great, but it also means you go, my goodness, as a woman, people typically tend to be naturally more inclined to go to the maternal energy, which means I need to upskill myself to make sure I can keep up with that, I guess, societal expectation.
When I was at uni, we'd learn about peds and pregnancy, and, I was interested in it, but I didn't see myself practicing solely that way.
Yeah.
Female patients do gravitate towards us, and that's great. And when that started happening, as you said, we need to upskill. Whilst there was no interest there initially, I ended up deciding, I do need to upskill. And learning more about pregnancy, and after learning more about what the body goes through and how it changes and how it adapts, I'm like, this is friggin' amazing.
So much out there that says pregnancy is this torturous thing that has to be according to a time frame, that it needs to be done in this hospital room. If I think about when I was a little girl and we had a dog that had puppies, I think we forget that the body is designed for brilliance. The body is designed for health. The body is working exactly as it should. Nothing in nature is not on time. And I think that there's heaps of misinformation around what the pregnancy should look like. Each pregnancy, from my understanding, is going to be so unique and individual, and it doesn't need to be this controlled, medicalized, in a room with unnatural lights, this painful thing which Hollywood makes us think that it is and social media makes us think that it is. So there's plenty of misinformation about it. I do agree with you.
And I guess learning about all of that and the truth behind it all just really inspired me to get out there and help as many pregnant women as I can, and also help educate them about, about the system and what their choices are. I think that's something that's not spoken about enough, is what choices they have while they're pregnant, and also while they're giving birth, and even after that.
Scare tactics, emergency C-sections, epidurals. I think of again, Hollywood, feet in stirrups, women are screaming. I would love to hear more of your thoughts around that.
We're all programmed to think sort of medically and controlled systems, and women just need to know their rights. If women were just giving birth when their bodies were ready to, at any random time, how do the hospitals know they've got doctors available, rooms available, beds available, right? If they can, schedule people in for C-sections, it's just more controlled.
Convenient.
It's more convenient. We've also got to remember that a woman's pregnancy, it could be her first pregnancy, actually doesn't even matter, it could be a 5th pregnancy, but they're in a vulnerable state and probably not in the right state to be making decisions, right? So it's really important that women are aware of their rights, and their partner is also aware of their rights as well, because they're the ones ultimately in that room with them, in the hospital room, probably making that, last decision.
In 7 years worth of practice, I'm going to make a very unfair assumption. You're a beautiful woman, obviously. I'm going to assume you have maybe had some inappropriate interactions from maybe male clients. If that is the case, how have you handled it?
You need to create boundaries and remain professional. But I can tell you there are definitely a fair few people who I've blacklisted from being able to see me. And it's hard because all you want to do is do your job, be professional and get patients the outcomes that they're after. And what I struggled with was when you've been seeing a patient for a long time, or maybe it's a few months, and they're happy and they're coming back, and then they'll make an inappropriate comment, or they'll ask you out on a date or something, and I'm like, have you been coming in just for that? And it's almost like an insult, because I thought I was helping you, I thought you were getting the results you were after, but now it's almost like you've had an ulterior motive this whole time. How I deal with it, it depends on the severity of the issue and the context, but normally I would, let them know that it's inappropriate. It's also about, wanting the best for that patient. If you've got someone else working there, especially a male, and they can continue their care with someone else, even though you don't feel comfortable providing it anymore, at least you know that they can continue their journey. And in some cases, like I said, I've pretty much had to ban them from coming in.
My heart really goes out to women who are maybe solo in practice or have other female CAs. There's, at least my experience of it has been, when you have a male CA or at least another male doc on, it almost gives you like a sense of like, because if heaven forbid something like that happened on shift, you've kind of got that masculine energy that you can go to or lean on. Not that as women we can't not handle it, but yeah, my experience has just been when things of that nature have happened and you need to go to someone or have that extra support, it's been really helpful. So yeah, my heart goes out to anyone who's like solo female.
But how have you coped with that in the past?
Now that I've been in practice a bit longer and I have more confidence in holding that boundary, it's a lot easier. And similar to like what you were saying, Mary, it's like hey, that's unprofessional. I'm here to help you achieve XYZ goal. That's what we want to do, right? Like that's the purpose of this. And just depending on the severity of it, the nature of it, whether or not it becomes a case of I choose to no longer accept them as a client, or I refer them to a different doctor, or I give them other options. That's obviously something we explore too. I can't say that it gets any easier. I think you just develop better boundary setting skills. And I can't say, I would like to think that I'm a pretty confident person, but despite that, there's always a bit of a quake in your voice, or your hands shake a little bit, or you get a little bit sweaty, or you think, did I handle that correctly?
You also don't know what their reaction's going to be.
Correct.
And if you've handled it right as well.
Exactly.
There's been times where they don't take no as an answer, and they don't want to see any other chiropractor, and it's that kind of that battle. You don't want to come across rude or arrogant or anything like that, but it's also want to juggle setting a boundary and being firm on that.
Yeah.
Whilst also anticipating what the reaction's going to be. I think that's what I struggled with initially. I was always thinking, well, how are they going to react to this?